Hi, I'm Sanjay Jeganathan. I am the chair of the Council of Presidents of Medical Colleges, and this is a group of 15 specialist medical colleges which are part of the Council of Presidents. So 15 medical colleges presidents are part of the council. And the objective of the Council of Presidents of Medical Colleges is to work collaboratively with one another and deliver the best healthcare outcome for all Australians, irrespective of where they live in Australia. And that is the objective of CPMC. There is severe shortage in the regional and rural Australia for specialist healthcare. And when I say specialist healthcare, it also includes general practice. That general practice is part of specialist care delivery in Australia. And it is projected that by 2030, there will be a shortage of 5,000 doctors. And that is critically going to affect, and it's already affecting, delivery of healthcare, quality healthcare for the regional and rural Australians. And it's a huge concern for all colleges and CPMC. And we are determined to address this inequity and make sure that we deliver the healthcare which patients need in the regional and rural Australia. This year, in particular, if I'm to talk about the strategies that have been deployed, the Royal Australian College of General Practice has given over 500, almost 550 training positions in regional and rural Australia. And 80% of the rural and remote medicine college, that's the ACRM, Australian College of Rural and Remote Medicine, 80% of their qualified general practitioners are working already in rural and regional Australia. And this is a huge win because of the priorities of the colleges, particularly RACGP and ACRM, in addressing delivery of health service in the regional and rural Australia. When you look at the specialist colleges, there is a rural hub that has been set up for delivering surgical training in Darwin, and that has begun this year in 2025. And the Royal Australasian College of Surgeons is committed to delivering surgical training positions in rural and regional Australia. All colleges are making initiatives to deliver this outcome. And there is College of Anesthetists is delivering over 350 rural training positions to deliver anesthetic training in rural and regional Australia. The current government is pursuing, as a result of Crook report, the initiative of specialist international medical graduates being fast-tracked to come into the country. Medical Board of Australia has already allowed for general practice, psychiatry, and anesthetics to enable doctors who are qualified from Ireland, UK, and New Zealand to come over to Australia, given specialist medical registration by the Medical Board, with no involvement of the colleges to assess suitability of such candidates. Now, we all agree we need more international doctors because the local growth is not enough to sustain delivery of healthcare, but it needs to be done in a very carefully calibrated manner. What is really important to emphasize is when you look at the statistics of international medical graduates in 2019 to international medical graduate admission to Australia in 2024, there has been a 91% increase in the number of international medical graduates coming to Australia. And that has been delivered by the colleges. Colleges have assessed suitability of such candidates and given them the right to come into Australia to work as specialists. So even without the expedited pathway, colleges have, since COVID, delivered an accelerated international medical graduate admission, and that has already worked. But the government is insisting that this is a solution that's going to address the problem. And we know it is not going to address the problem because experience and statistics show most international medical graduates who come into the country within between 2 to 3 years, they move to the major cities or regional cities. So the regions get affected again, despite a pipeline of foreign doctors coming to alleviate the problem. The strength of the local training program is when you look at the experience of the rural medical schools, various universities around the country changed their strategy. About 20 years ago, they started training rural training of medical students, admission of doctor training in the rural and regional areas. And various medical schools have opened their doors for this kind of training. And some rural medical schools have been set up, a number of them. And that has proven to be a success because when you train medical students from the regional rural areas who hail from those areas, they want to work in those areas. This is what we are asking the government to fund the specialist colleges to deliver rural regional training. It has got to be a coordinated effort by the federal government to support specialist training in rural regional areas. Unfortunately, most specialist training, almost 90% or over 90% of specialist training, is funded by state governments. And one of the ironies is that state governments do not really share or with federal government, and federal government does not share much of their statistics of where it is needed most with the state government. So it is a continuing problem. And all we are asking is for the colleges to play a crucial role in solving their problem.